Now I'd like to welcome last year's Medical Visionary Award recipient, Dr. Drew Schroeder, to present this year's Medical Visionary Award to his good friend, Dr. Hackmeyer.
Good evening. Tonight I'm presenting Lupus LA's Medical Visionary Award to Dr. Paul Hackmeyer. My name is Andrew Schroeder. I'm a pulmonologist who works closely with many lupus patients, and I work with Paul whenever I can. Dr. Hackmeyer is an esteemed obstetrician and gynecologist who has spent much of his career helping people with lupus. Dr. Hackmeyer has several accomplishments to be proud of. He was chief of staff at Cedars-Sinai when there was a sea change in how hospitals are judged and paid accordingly, according to quality and safety data. That was a monumental task, and he got the job done. He also started the Leadership Development Program at Cedars-Sinai, which helps young physicians lay the tracks to become an advocate for their institution and therefore their patients. I'd also like to mention Paul's biggest accomplishment, which is he is a practitioner of bonsai. And yes, bonsai is the Japanese art form of miniature trees in little containers. He actually won Best of Show in a bonsai society in California. Besides his massive influence in the lives of his patients and as an administrator, I think Paul is most proud of his solid family life. He cherishes his wife Nancy and his three mostly grown children, Brenna, her husband Chris, Casey, and John. They already have one grandchild, Jake, and one more on the way. On a personal note, Dr. Hackmeyer has literally been present for the highs and lows in my family life. He was the first doctor my wife Jody and I met when we came to Los Angeles in 1999. And he doesn't know this, but I modeled the way I behave with patients after him. He is kind, he exudes competence, and he's direct. All of the above make him an excellent human being and physician. Ladies and gentlemen, I present to you Paul Hackmeyer, winner of the 2016 Lupus LA Medical Visionary Award.
Thank you very much. I think I'm going to have to change gears a bit from the previous recipient. I'm not sure I can match that, so I'll just launch on to mine. When I arrived for my monthly infusion several months ago, Dr. Wallace pulled me aside into one of the exam rooms for privacy. My first thought was that I was in trouble and the labs had come back abnormal with, yet again, something wrong. Instead, I was surprised when Dr. Wallace asked me if I would accept this honor, and without thinking, I blurted out, "Why me?" His response was, "Because you have been taking such good care of my lupus patients for all these years." After the infusion, as I walked back to my office, I thought, but really, I'm just doing my job. So I thought a couple of short stories tonight I would share with you to illustrate that maybe it's not quite that simple after all. KM is a 39-year-old woman who came to me with a long series of complaints that started shortly after her delivery. As I sat listening to her, she told me that her past medical history was notable for lupus many years before, but that had gone away. Her pregnancy was unremarkable, had resulted in a cesarean delivery of a healthy baby girl. Shortly after the delivery, KM started to experience fatigue and muscle weakness, just like every other new mother. However, the weakness became more pronounced, especially on one side, and then progressed to her requiring a cane, and finally she needed a walker to move about. She stated that an extensive workup at that time suggested there may be a blood clot in her brain, but it was a soft call, and therefore no further workup was done. Her story struck a chord. In 1977, as a medical student, I was experiencing fatigue and muscle weakness, but that was expected. After all, this is medical school and it's supposed to be hard, right? One Saturday night, I was just off call, and we had plans with old friends from New York that we hadn't seen in a while. I was exhausted, but we just had to go. This was too important to miss. Dinner was great. It was good to spend time with friends, good to catch up. I was getting very tired, and then halfway through the Ville Marsala, sitting straight up, I just fell asleep. Our friends offered to end our time together, allow me to go home to go to sleep. And my wife says he does this all the time. And so they finished the main course, they had coffee, they had dessert, and then my wife woke me up. I was a bit confused. I was looking around, was the meal over? How long had I been sleeping, and did anyone notice? I turned to my wife and I asked, did I have the dessert? And she said, yes, the chocolate torte, your favorite, you loved it. And then we left. After a while, other symptoms presented, migraines, especially with weather changes and change of seasons, pleurisy, inflammation of the lining of the lung, blood clots, and then after several kidney biopsies, the diagnosis of lupus was made. I was placed on several medications, eventually resulting in stabilizing the disease, but at a cost of an extra 35 pounds. And so, 20 years went by. I was pretty much stable, fluctuating from time to time, especially worse when the seasons and the weather changed. I was able to predict the storms 48 hours in advance with great accuracy. And then suddenly gone. The lupus went away for a dozen years until fairly recently, when I found that I was able to predict the weather again and found it had returned. Thankfully, Dr. Wallace has kept me stable and functioning at a high level, with some recent help from Dr. Khalsa as well. When KM finished her history, I said, wait a minute, muscle weakness, fatigue, blood clots after delivery? I think you've had a lupus flare. I explained that commonly after delivery, lupus can flare. I told her I have just the man for you. Long story short, I sent her to Dr. Wallace, who of course made the diagnosis of lupus. Subsequent referrals to neurologists, hematologists, diagnosed a postpartum stroke, which thankfully has resolved almost completely. When KM returned to my office for follow-up, she said, I was feeling all alone. No one could understand what was going on. How did you know? I told her she is not alone. I have lupus too, and I've had many of the same symptoms on and off for over 30 years. Lupus flares after a delivery, and that was the key for me. I'm grateful to be able to care for my lupus patients. I am grateful to bring a unique perspective to caring for my patients, and I'm grateful for your recognition tonight. Thank you.